Welcome to Dementia-Friendly Prince George's County, Maryland Northern Sector webinar series for caregivers. Today's topic is effective communication strategies, sponsored by Prince George's County government and the Department of Family Services.
So I think, first of all, I want to thank everyone for the opportunity. Thank the hosts for the opportunity to come and talk to you all this evening. And I want to thank everybody for attending this evening. It's really our pleasure as the Alzheimer's Association in the Capital Region here to come out and do some presentations virtually and be able to connect with all of you. So again, my name is McLean. I am a community educator with the Alzheimer's Association, this Capital Area region that serves Northern Virginia, DC, and Maryland area. And my connection to Alzheimer's is through my family, and dementia, Alzheimer's and dementia is through my family. My grandmother had dementia, related memory loss and function loss, and my father had Alzheimer's and dementia, and he passed away in 2019. So that kind of gives me this firsthand knowledge of what a family experiences and kind of experiencing also to see what happens in those changes that happen to someone when they experience Alzheimer and dementia. So tonight we're going to talk about effective communication strategies linked to dementia and Alzheimer's. Go ahead with the next slide, please. So our learning objectives. By the end of the night, or by the end of this evening, we are going to explore communication and how it takes place. And so by this program, what we really want to explore and be able to take away is explaining the communication changes that take place throughout the course of the disease, decode the verbal and behavioral messages that are delivered by someone living with dementia, and respond to ways that could be helpful for that person, and identify strategies to connect and communicate throughout each stage of the disease. So next slide. So what is communication? Go ahead and move forward. I think this got some animation right. So communication is more than just, we know it's more than just talking and listening to each other. It's also about sending and receiving messages, both through our attitude, our body language. This word map kind of has a lot of different ways that we communicate. And we also know that these different kinds of types of communication really change when someone has dementia or Alzheimer's. So the brain changes when someone has Alzheimer's disease and dementia and other dementia-related progressions of disease. So people actually will lose their ability to speak. And that's one thing we noticed really early is we have a program called 10 warning signs of Alzheimer's, and learning and having trouble finding a word is one of those warning signs. So we do know that's a pretty early sign that things are starting to change. But they also lose the ability to really decode language, decode what's being said around them, and being able to really effectively follow conversations. So we really know it's better to have that understanding from a caregiver or a care partner's standpoint. It's not just about what they say, it's also about what you say. So we really want to think about ways that are better ways and other ways to connect with somebody who has Alzheimer's or other dementia throughout the disease. Next slide. So we break Alzheimer's and dementia-related diseases down into really 3 stages. There's the early stage, and that's when the individual's earlier mild stage, and that's when the individual's ability to convey thoughts and feelings through language it's okay. It may start losing some of that. And they are also able to make decisions about future care. That's really important because you still have this opportunity in that early mild stage to start talking to somebody about the changes that are going to take place as the disease progresses. And also they may misinterpret what others say. So that's kind of also going to be that early stage changes that you may notice. The middle stage, that's actually kind of moderate as the disease progresses. And using basic words and sentences will probably continue. May have to rely more on tone of voice, facial expression, and body language to really start communicating and have that sense of communication. And continue to need emotional connection and meaningful activity. And we really like to talk about how people with Alzheimer's and dementia, they really need to maintain a sense of self. And so we know that sense of self, what that is, because we know these people. And that's kind of really an important aspect really at that mild and middle stage. And then the late stage, people may still respond to familiar words, phrases, or even song. Music's a great way to communicate in the later stage. And then also maybe using body language and the other five senses to connect. So we're going to explore each one of these throughout the presentation tonight. Go ahead to the next slide, please. So communication in the early stage. You may or may not see changes in the way a person communicates at the early stage. For some people, there may be shift in the ease with words or conversations. Some of the most common changes you may notice in the early stage are listed on this slide, including difficulty finding the right words, taking longer to speak or respond, kind of a pause, maybe something and that would be something that's unusual. That's a change in the person's behavior. Withdrawing from conversation, we already kind of touched on that. Struggling with decision making or problem solving, and that's that kind of ability to interpret and kind of process information. And then they also may react a little more emotionally than in the past, or avoiding discussions about the disease and its impact. That's pretty common too. Whether you notice these changes in the way a person speaks or not, communication in the early stage is really crucial. It's really critical. This is a period when everyone involved is adjusting to the diagnosis. You found out that a friend or loved one or somebody that you're close to has this diagnosis of Alzheimer's and dementia. So really it's important to convey these thoughts and feelings about the changes ahead of them. So remember that denial is part of the disease for some, and with other emotions, it really can feel overwhelming, that fear of the unknown. So we really need to come to terms with the diagnosis and emotions. And that can really be talking together and expressing that connection. This will help you both accept what changes, accept the diagnosis, and that there are changes that are going to happen, and then also discover new ways to live in positive and fulfilling ways together. So communicating throughout this process can really actually increase closeness among those experiencing Alzheimer's and dementia. And basically, hopefully everyone kind of adjusts to what's changed. So next slide is a video actually where Martha Turney from the Alzheimer's Association Maine office is going to talk about some of these things that might be helpful during the early stage. Go ahead and press play. Thanks, Erica.
Erica, Derek, could you hear that?
I can't hear it. Can you hear it?
We may have to mute your mic. Give me a second.
Okay. I can mute it from here. I'll mute if you want to try to play it again.
Okay, great. Let's try. Erica, can you try to mute yourself too? I want to apologize to our attendees today. I'm sorry, I don't know what is going on with our audio.
So you guys weren't able to hear that either? Okay. Let me try something. Can you hear me okay?
Yes.
Try playing it again. Still nothing?
Yeah, I can't hear it. Erica, did you change something about your audio, possibly?
No, I didn't change anything.
Okay. Hit play. Play now. Oh, it's still not working. Even with yourself unmuted?
Yeah, I'm muted.
Nothing. Did you check the volume on the screen? Yeah, that's all the way up. All right. So we thought we had this worked out. Can you guys hear me okay? I changed some settings. I just want to make sure you can hear me.
Yes.
Okay, you can hear me. Okay, well, we'll continue to work on that. So we got a couple other videos that we'd like to show. So we'll continue to try to work on that to get that audio working. But really what Ms. Turney is telling us here is kind of, really some important takeaways and points from this is caregivers may struggle to know how to help the person with communication in the early stage. And you may have to basically just talk to the person directly and ask them how to help. You just have to be straightforward and say, how can I help you deal with this? And how in the future do we want to be able to communicate? And they may say, well, I respond better to texting, I respond better to writing, I really want you to talk, those kind of things, or phone calls are the best way. So that's kind of some of the ways that some of the descriptions that Ms. Turney says. And basically just asking them the preferences and help being respectful to their feelings as they're going through this, understanding what's the changes that are starting to have and expectations. So let's go to the next slide. Okay, so communication in the early stage. One of the best ways to make sure you're offering help with communication that really needs to ask very direct questions, be very straightforward. For example, if a person struggles to find what is the right word, at that stage, this early stage, it's a really good time to ask them whether it feels better for you to supply the words, you to fill in their gaps, or for you to wait patiently until they fill in that gap, whether they're struggling or not. It depends on the person. It depends on kind of how they're approaching this. Keep your sentences direct and straightforward to help the person avoid feeling lost in a conversation. Again, they're having difficulty processing information. So very straightforward and very direct discussions can be really helpful in making things clear. It may take a person longer to find the words and put thoughts together. So be sure to allow extra time for conversations. You don't want to rush them, so no one feels pressured. And keep in mind that a conversation needs will change over time. And in the early stage, the person with dementia needs to have his or her own voice heard. So you can help facilitate this when you meet with the person right where they are today. And that again is kind of talking about their sense of self. And so also be sure to include the person in any conversation that they wish, especially when it's talking about their future and decisions that are going to impact the future. Some of these, including the person, can be really empowering and really important for them at this stage. Let's go to the next slide. So always keep in mind, don't make assumptions about somebody that is experiencing Alzheimer's or about their ability to communicate because of the diagnosis. The disease affects each person differently. We're all different. We all age differently. We all approach life differently. Alzheimer's and dementia are going to progress differently in each person. So we have to remember that. You want to speak directly to the person so they know how he or she is doing. Explore a method of communication that's most comfortable, maybe texting, maybe writing letters, phone calls, maybe straightforward in person. Maybe they like to go on a walk and talk. It's that kind of approaching this different kind of ways to do this. It's okay. We also remember it's okay to laugh and sometimes sometimes just kind of keep the mood light and make the communication a little bit easier as well. And be honest, don't pull away, be straightforward with the person. Friendships, family relationships, those are important, really become more important with the person with dementia. So next slide. So now transitioning from that early stage where, remember, sometimes a word might be hard to find, maybe they're starting to struggle a little bit, and maybe a little bit of difficulty with interpreting information, to this middle stage. So we may start noticing some more progressive changes. So in these middle stages of Alzheimer's or other dementias, that's going to affect communication. So we may start seeing more difficulty in finding that right word, more difficulty in using familiar, finding the right word, and that switches over to the person using more familiar words repeatedly. I noticed this in my father. We would go out in a social event or something, and he used to, would greet people with maybe something unique about the person. And then it sort of progressed into, he would say, fine, how are you? Or how are you doing? And he would say that to every person, not only somebody that he was meeting for the first time, but somebody that he'd known for a long time. So I started noticing him using that kind of, and I look back and think that I didn't really understand it at the time. So also inventing new words to describe familiar things, such as calling a watch a hand clock or something like that. My dad sort of forgot the dogs' names, and he would call them those furry animals over there, things like that. Sometimes easily losing a train of thought, speaking less frequently, we talk about that withdrawal, and then also communicating through behavior rather than words. And we really need to think about that. You may also think that difficulty organizing words logically, the sentence structure of the conversation may jump around. Reverting to speaking in a native language. And that's not uncommon. If someone's first language, for example, is Spanish or French, they may start speaking in that language. Sometimes people, kind of revert and start using curse words or swear words and unexpected behavior. That's just, that's not outside of the realm of possibility. And then relying a lot on hand gestures, difficulty following conversations like we talked about. So these are all changes. We know that changes are going on in the brain, and decoding words is more difficult. For that reason, really, people begin to use behaviors more to communicate in this middle stage. They may use their hands more. You need to start adjusting. Again, this comes back to living with that person and being with that person where they are at that given time. So we have to remember that the disease is progressing. They can't control it, but we can control our response to that. So we also have to remember that. And then also know that sometimes physical conditions and medication can affect people's ability to communicate. If they start taking medication in this middle stage for Alzheimer's, or maybe some other health issue, it can change. We could see a dramatic change suddenly. And that's always important, is that we want to consult a doctor if we see sudden changes. And that just really needs to stay in a conversation with our health professional. So let's go to the next slide, which is a video that I hope we can hear. Let's try it. Can you guys hear that?
Is it possible, Dr. McLean, if you could summarize what she is saying?
Yeah, I definitely will. I mean, really what Beverly is talking about is she's sharing advice that she gives to caregivers as a support. She's a support group facilitator. So she's giving advice, and she's talking about taking your time when responding to people. You can't expect the person living with the disease to behave as he or she might have in the past. That they're going to change. Their personality changes are not unusual. So you have to have a reasonable response to that. And if communication is not getting the desired response, if your approach is not getting the desired response, focus on what you can change. Because again, it's about being in that place with that person, and you have to alter the situation. That's kind of basically a summary of how she described what she's describing. And she's a support, like I said, and she actually has a partner or caregiver role. So let's go to the next slide. Okay, so communication in this middle stage to connect with a person. So some tips on how to do that. Identify yourself, approach the person from the front and at eye level. You don't like to kind of come up from beside somebody. Oh, my battery's running low. Is that my bad? Oh, That's the host battery. Okay. Approach the person from the front, say who you are. Basically, you know, at eye level, you don't want to sneak up on someone. Hi, Dad, it's your daughter, or hi, Dad, it's your son, or something like that. Help orient the person who's around them. Sometimes just a gentle touch or, you know, on the shoulder can really help somebody understand that, you know, this is a friendly situation. This is a good situation. Maintaining that eye contact again. Don't criticize or impose your perspective. Most of the time that kind of backfires and turns into an argument. You don't want an argument. You got to remember that you want to stay calm and patient with the individual so they can feel, they don't want to feel tension from you. They want to feel understanding because you're trying to, again, meet them where they are. And take time, really, just take your time to communicate. Give yourself and the person some little extra time to talk, to interact, and connect. So next slide. That's another video. So really this one, the person is Rebecca. Do we just want to move forward? So Rebecca, actually, what she's talking about in this video, about adjusting her own thoughts and responses when her mother started repeating herself. And really what she does is basically she talks about the frustration and the frustration of living with someone dementia, especially when they repeat themselves over and over, and how you just get to a point where you just want to say you've already said that. But they don't realize that they've already said that multiple times. Rather than trying to convince that person of what you remember happening, it really helps to meet the person where they are. And you have to accept that the person does not remember that they just said something to you, that they're going to say it again, and they're saying it again. So you really have to accept that person's perspective and really understand from where they're coming at, understand where they are. So it's just kind of a personal anecdote about, you know, the frustration of dealing with somebody that just repeats themselves a lot. Next slide. So communication, to connect, again, let's think about how we can connect. We want to respect the person, keep empathy in mind. You just want to join them in their reality. Take a little time to kind of give a sense of where they are in the world. What is their perspective of the world? And how is this disease kind of changing them? The person will probably not be able to see from your perspective. They won't understand why you're frustrated or things like that. So it's really important to kind of take some steps that we list on this slide. So keep in mind that the person may be saying something about his or her feelings or needs, but maybe feeling something even on a deeper level that needs attention. So you may want to just say, you know, words like, if they say, for example, I can still drive, they may really, you know, I can drive fine. They may also be expressing a feeling of independence or that they're scared of losing their independence. So there's probably something a little deeper there. Stop taking over my life. I don't like what you're doing. May actually mean I hate this disease and I don't understand, and I don't understand why it's happening. Why I can't do what I always wanted to do. So you have to let that person know that you understand that what he or she may be feeling and why, and try to address those issues. Provide a brief answer. Try to be brief and to the point. Respond to the emotions behind the behaviors, or really the concerns. You may want to say, you seem sad. Do you feel sad? And then wait for the response. And do you miss the way things used to be, for example? If the person says yes, then you says, well, really, I do too. I miss the way things used to be. And, you know, you can really identify and speak to those emotions. And really, if you're responding to emotions, really try to reassure and redirect the person by encouraging him or her to do something that may shift the person's thinking. This is a great way if they're kind of in a loop, for example. My dad used to get in kind of loops that, you know, it's a great way to kind of redirect them and say, you know, I'm glad to be here with you today. Let's go for a walk outside. You know, we got to a point where pretty much every visit we just go for walks. And we talk about nature, we talk about things like that. So it was really a way both to lift his spirits and also just sort of to get him out of a loop or get him away from kind of where he was stuck. Next slide. We want to keep it short and basic with, you know, being patient, short sentences, basic words. We want to start speaking a little bit more slowly. One person at a question, you don't want multiple voices coming in. You don't want really complex sentences or long stories at this point. You want to kind of keep it calm, limit distractions. Maybe if they're having trouble concentrate and the TV's on, maybe we want turn the TV off or something like that. Also, we want to keep it, for example, rather than saying kind of an open-end question like, what do you want for breakfast, where they struggle coming up with an answer, it may be more like, it's breakfast time. Would you like eggs or oatmeal today? Those kind of specific things. And offer a guess if no one words is not acceptable. See, we tried to have that conversation beforehand. We may or may not remember that conversation or those decisions, but really maybe try to fill in some of those gaps. Next slide. So to connect, give multiple clues at this middle stage. So this is where we're starting to need to rely on multiple senses. So we've almost all been verbal communicators, maybe a little bit of visual communication with hand gestures or things like that. This is a stage where we want to start giving multiple different cues. And that's ways to reinforce what we're saying and to improve that communication. So visual cues and gestures are important. We want to avoid sudden movements, though. We want to use gentle postures like pointing or kind of, moving slowly in one direction or not. We may want to start writing things down for the person, notes, calendars, ways to do things like that. Remind the person where things belong, where they are. This is also when you might start having trouble. Person might start having trouble retracing their steps to find their keys or something. So it might be good to start writing down, put the keys, or the keys are always in the spot. Offer answers to questions. It's much easier for someone in the middle stage to choose what to eat for lunch. Again, like I said, is lunch or some food be to be specific, like I'm making sandwiches, would you like ham or turkey or something like that? It's another example. And then repeat information. Again, this is, you got to avoid that frustration that you have to repeat things, you have to connect with the person where they are. And then maybe even trying to turn negatives into positives. So example is for, if a person trying to get them into the shower, they may resist the task rather than saying it's time for the shower. That would trigger a resistance. You can say something like, let's go get cleaned up for the day so be ready for your daughter's visit or for somebody to come visit. That's happening this afternoon, so let's get you ready for that. So that may kind of shift that conversation or reframe it. And then avoid quizzing. Asking why are you doing that, or expecting them to try harder, or that was something we really had to adjust. My dad was, a quite independent person, and that was a real challenge for us to adjust, is to understand that he wasn't able to make those decisions, and that we just had to basically understand and meet him where he was. And so we didn't ask. We learned not to ask why are you doing something. We just learned to accept kind of his behaviors and be with him at that point. So next slide. Again, here we just kind of refresh what we're talking about and summarize. Join the person's reality, try to respond empathetically and reassure them. The facts are less important than the person's feelings a lot of times at this point. It really is no point in kind of trying to say, no, that's not the dog's name. And that, that's their reality. They're not going to come around to your way of thinking. Provide reassurance that you are together and safe, and that they are safe, and that you're there to help. And validate and redirect. Agree to go with the flow, finding common ground, and then redirect the person, as we said, to try to get them to have to get them moving into an activity that is important for them. So next slide. So we've talked about the early stage, and now we're kind of in the middle stage, and now we're getting to the late stage. Now, communications at the late stage can become really challenging, at least verbally, and the individual being able to understand what you're saying. So it may be reduced all the way down to a few words or sounds, or like my father, it got to the point where he just really didn't talk at all. And possible may respond in familiar words or phrases, but that it just really depends on the individual. So really now the changes come to being able to connect, listen to expression of pain and respond promptly, because again, these are individuals that need care, and they're not able to really necessarily have all the behaviors that are necessary to keep themselves safe. So we really want to try our best to keep them safe and happy, and that is really just kind of really paying attention to them. So this is a great point, and this is a great time where we've had these conversations and we kind of need to discuss and remember the person's history and really remember kind of what they were like and what their preferences are. And if their preferences have changed due to behaviors associated with dementia or Alzheimer's, we kind of have to keep that in mind. The goal really here is to help keep the person content and safe. So we want to keep talking. We want to use familiar words. We want to help, kind of keep that person engaged. We want to help remember that person say that sense of self that they had. So this is a great time where you use familiar phrases or maybe a song or a poem or just a statement or just sort of something that you've always used in your relationship with that person. It's a great time to bring out pictures, to say, oh, remember this, remember that, just to kind of help that person communicate. And this is also where we have to kind of transition from just verbal communication to using all the 5 senses: touch, sight, sound, smell, and taste. So we really want to start developing communication strategies using all the senses. So that is really when we're trying to connect with the person's feelings. And so that also maybe can help them stay a little more comfortable. Next slide. So this is a video, and this is Sandra kind of talking about how she connected with her mother in the late stage of disease. And in this video, she talks about how her mother liked to wash dishes a lot and, kind of keep the house clean. And so she would get to a point where she just needed to kind of just let her wash dishes. She would maybe potentially wash dishes for, a long period of time. And that was okay because her mother was content, and it was kind of meeting her mother at a place where she wanted to meet. So she would wash kind of the same dishes over and over. And that was kind of a good experience for her to be able to kind of ease that frustration and meet her mother kind of where she was at that similar place. And it's another way of using all the senses, and that she was kind of would turn on some music, let her mother work at the sink, wash dishes, and kind of hand her the same dishes, and then she would have that comfort of doing something that she enjoyed, being surrounded by the senses that she was familiar with. Next slide. So here's potential ways to communicate, connecting through touch. We're going to talk about each sense kind of in different examples of ways to use each sense to communicate it. And you see some examples here, like the fabric, identifying shapes, things like that. Potentially using hand lotion to give, a hand massage, or identify everyday items in a bag of touch. Really what we're trying to do is engage and connect with the person and, keep them active and give them, a sense of activity that's going on. Visiting with animals is great. There was a dog that would come by my dad's memory care unit every week, and he loved visiting with that dog because he'd grown up with animals, and it was just a great experience. Maybe even sculpting with clay, or just holding a person's hand, or just having that physical connection can be really, really important at this stage. The next slide, we're going to talk about the next sense, which is sight. So maybe this is where we can go and get some videos, watching videos of animals or nature, but really pictures are great at this point, and getting pictures and maybe laminating them so they're really tough, so they can really be handled. And pictures of the family, pictures of familiar places, maybe places where somebody grew up, maybe places that they like to visit. Those are really our favorite paintings or settings, prominent people in the past that they admired. Those are the kind of activities, or kind of potential way to really connect, to get the person started to be a little more active. And we have examples of going outside, bird watching in an aquarium, or painting with painting. Of course, is a great physical activity. If they can just paint and be creative, and maybe just going and sitting by an open window and observing what's outside, such as if it's rain or thunder or lightning, but obviously in a safe way, or something like that is also really helpful. So in the next slide. Now, sound is really, I think, one of these areas that we're learning more and more about as far as a way to connect with somebody with Alzheimer's and dementia, and that's really through music. And the ability to stream music and have earphones and earbuds and just listen to music, and just having all this music available is actually helping us really understand more about how music can connect with people. So again, listening to the familiar music, maybe from when they were young, a lot of times people connect more with earlier in life, and some favorite songs. And that's why it's a great point now to, in the middle stage to kind of talk to people about what were your favorite songs, early and middle stage, and then also connecting with friends and family about things that the person really enjoyed. Listening to speeches, poetry, if they enjoyed that, or again in a native language, if the first language was not English. And also maybe just hearing people talk to them is just enough. And maybe just recording old friends and just playing something that an old friend says or telling a story that the person can sit and listen to is also a nice way to connect. Next slide. So smell, a lot of us have, I have memories of, I smell something and I'll think about, gosh, that reminds me of my grandmother's house. Smell is one of those amazing memories that, or amazing senses that, can take us back to things that we really, are surprised by sometimes. And this is one of our really, basic, it's an early sense because it's really for protection. So, and smell may diminish though as people age, but we really like to consider using, smell as a potential way to connect with somebody. And it can be something that's unfamiliar, like we're talking about, essential oils or something new, or grass clippings or herbs and spices or something that if they really like to cook, this is a great way to connect with a person. And of course, if they like coffee or tea or different things like that, that's a great opportunity as well. Candles and fragrances, of course, using them safely. Those are nice ways to connect. Maybe if it's an unlit candle, but we want to obviously remember to do everything safely here. But what we want to do is, again, connect smell back to somebody in a way that they may be familiar with, that may help them remember, or give them comfort or recall things that are pleasant to them. But we also want to avoid anything that could be a little too intense that may aggravate as well. Next. And then taste. We all like, snacks and goodies. One of the things we always did with my dad was I'd go visit and I'd take him to the shop in the facility, and we'd always go down and get chocolate chip cookies. That was always one of his favorite activities, and maybe hot chocolate or something like that. So it's really great to kind of reconnect and just have the person take them, and a strong sensations again associated kind of with smell. But this is an important thing to remember, is that as people age, Alzheimer's can really start to impact function. So if people are starting to have trouble with swallowing, or if they have, kind of a medical issue associated with digestion or something like that, we have to remember kind of keep this within the realm of what they can handle and what they can manage. But, popsicles, flavored drinks, pudding, ice cream, all those are excellent examples of ways that we can connect with taste. So next slide. Okay, so communication at all stages of the disease. Kind of wrap this into I'm trying to keep an eye on time so we have a few minutes for discussion. So really we want to maximize the connectiveness with a person, and remember that we want to connect with them at their reality and and remember their sense of self. So we need to understand and accept, what we can and can't change. We have to meet them. We have to stay up to date. It's really important that they retain their sense of self, and that you respect that and you kind of meet them on that level. We always encourage people to stay up to date on the latest information and scientific knowledge of Alzheimer's and diseases by attending workshops like what you're doing there. And we also, through that kind of have to recognize what are some of the functional and cognitive limitations that the people are going through. So we want to use feelings to connect. We want to use the senses. We want to keep our tone of voice. We need to remember that's very important. People obviously pick up on the feelings and the sense that you bring to the room or you bring to the conversation. So we like to stay calm. We like to encourage that and stay focused on these positive feelings for the person. And again, kind of connecting to them and demonstrating. That helps demonstrate care that you have for the person, and you really want to help them go through what they're doing. Trying to decode what they're communicating. They're not able to speak, so maybe there's some examples of, say, for example, if somebody really rejects to getting a bath, maybe they had a bad experience with the water being too hot or something like that. So we kind of have to remember that maybe something went on or happened that we have to really pay attention to. So we really help to meet their needs in as soothing and calming way to better understand what is needed. So next slide. I think it's a video. So this is actually a physician with the Alzheimer's Association main office. He describes what he's really talking about is remembering that the care partner and the caregiver needs care as well. It's not just the individual that has the disease or has experiencing the problems. So we really want to emphasize that you have to care for yourself, and you have to remember that you're important too. You're important to the person, and these changes have an effect both on you and the person that's experiencing them. You're both living with this disease. So to better care for the person living with dementia, you need to better really care for yourself and your own emotional needs. So next slide, please. So what are the resources that are available? Well, we have a lot of resources. This is where the Alzheimer's Association really can help provide a lot of support and a lot of resources. So the first one is through the 24/7 hotline, 1-800-272-3900. This is around the clock, 7 days a week, 365 days a year, 24 hours. These are specialists, master's level clinicians. They offer support and information, social workers that can connect you to resources. They are available for both care partners and caregivers and the person that is been diagnosed with Alzheimer's and dementia, so they can provide that support. It's offered in many languages, so you can really get that help you need. And it's not just about what's happening. They can provide support and advice and get you resources for legal problems, for financial issues, to help find partners locally, to help find your chapter locally, and medications. Really some really important things that are important for you to start, kind of putting those pieces together when somebody has been diagnosed with disease. So there's one way that Alzheimer's Association can help you. Next slide. Education programs, really, we're really impressed that first of all, you come out, for example, join this one tonight. You're making a great step to learn more. It's really impressive. We have other programs. We have programs available online. We've become a virtual world due to the COVID pandemic, where a lot of things that weren't available online are available online. We also provide other trainings like this, where you can have somebody go through a program with you. I mentioned the 10 warning signs, understanding Alzheimer's, how to have conversations about dementia and Alzheimer's. We're doing the communication strategies. We're not financial or legal advisors, but we do provide programs and overview of those kind of things. And also understanding and relating and responding to dementia-related behaviors is also really important, because that helps you understand why is the person doing that, why are they approaching this way. Next slide. Our community resource finder, this is a great place online. If you go to alz.org, you can get to these resources. That's often the first place a lot of people find the Alzheimer's Association, through the website. These resource finders are great because it connects you potentially with resources in your local area. As you can see, we have just great buttons here that go right to the Alzheimer's events programs, AARP, Care at Home, housing options, medical service, community. Really important information that can be really a great resource for you. Next slide. ALZ Connected, this is a free online community. I mean, we understand that people connect online. We understand that communicating through the community and social media is really important and critical right now. So Alzheimer's Association has these forums. You can see there's a caregivers forum, there's an I Have Alzheimer's forum. It's a great way to communicate with others. You can connect with people kind of maybe who are experiencing the same things that you're experiencing, and then also maybe kind of in your area. So this is for people living with the disease, caregivers, family members, friends, individuals who've lost someone to Alzheimer's or other dementia, or individuals or people you're just trying to get more information and just bounce some ideas off. It's a great way to connect there. And the next slide shows the Alzheimer's Navigator, which is, go ahead, yeah, which is also online resource. You can see you have these buttons that can really go, what do you want to know? You just click on those and it can start getting, kind of these frequently asked questions, and start giving you some daily living care options, all these different areas, financial planning. It's a free online tool that helps guide caregivers and partners to answers, really to create this, an action plan. This is a great one to visit early on. Next slide. So with that, we're at 51. Wanted to leave a little bit, 51 after the hour. Wanted to leave a little bit of time for discussion, questions. I'm happy to do that. Kind of offer the discussion up to you too. We love to hear also experiences, and we also love to hear suggestions. So thanks so much for attending and listening tonight.